Think a heart attack always starts with crushing chest pain that knocks you off your feet. Think again. For people over 60, the heart doesn't always scream, it whispers. And if you don't listen, the consequences can be deadly. In the US, heart disease is the leading cause of death among seniors. But what truly worries doctors isn't just the heart attack itself, it's how it often strikes without warning. In fact, more than 50% of heart attack patients say they had no clue it was coming. The signs, too vague, too subtle, or they just felt like everyday aches and pains. Ever been so exhausted you couldn't even take a shower? Woken up at 2 a.m. with a dull backache, or felt slightly dizzy just from standing up? These seemingly minor issues could actually be early warning signs of a heart attack. Your heart's final cry for help before it's too late. Today, as a cardiologist, I'm walking you through 15 silent symptoms of a heart attack that most people completely overlook. And number 7, you might have had it just last night and never even realized. 1. Chest pain. It's not always a Hollywood moment. When most people hear heart attack, they picture a man clutching his chest, collapsing in agony, barely able to speak. But in real life, especially for those over 60, chest pain from a heart attack isn't always that dramatic. Instead, it might feel more like pressure or heaviness, like something is sitting on your chest. Some describe it as a squeezing, tightening, or a band wrapped around the middle of the chest, sometimes spreading to the neck or shoulders. This kind of discomfort can last for several minutes and then vanish. That's when many people brush it off as heartburn gas or maybe just a pulled muscle. But here's the scary part. These brief, mild episodes of chest pain could be early warning signs that your coronary arteries are slowly getting blocked. If you've ever felt a strange tightness in your chest, especially while resting, or after a heavy meal, don't ignore it. It might not just be indigestion. It could be your heart quietly crying for help. 2. Radiating pain in the arm or back, your heart's quiet SOS. Not every heart attack hits the chest like a freight train. For older adults, especially women, the pain can begin in the back, shoulders, or arms, quietly spreading without any of the classic chest pain symptoms you'd expect. Have you ever woken up in the middle of the night with a deep ache between your shoulder blades? Or felt a strange heaviness in your left arm, as if it were weighed down, sore, or just off, even though you hadn't lifted a thing? Many heart attack survivors report this kind of pain, dull, nagging, and easy to mistake for a pulled muscle or aging joints. But here's the truth, it's often your heart trying to warn you before it's too late. The danger: these symptoms are easy to dismiss as arthritis, poor sleep, or just getting older. But if the pain lingers for several minutes, comes and goes, or shows up with fatigue or shortness of breath, don't wait. It could be one of the most overlooked signs of a heart attack. 3. Neck or jaw pain. The silent red, when flagged especially in women. Ever felt tightness in your neck, a dull ache in your lower jaw, or a strange numbness creeping from your neck toward your ear? You might chalk it up to sinus issues, a dental problem, or arthritis. But your heart could be the one sounding the alarm. Heart attacks don't always start in the chest. In fact, for many older adults, especially women, the symptoms can begin in the neck and jaw, mimicking nerve pain. The discomfort isn't usually sharp or stabbing. It's more of a dull, nagging tightness that can feel like pressure, burning, or even a strange numbness. Some patients say it feels like a band is being pulled tightly around their neck. The tricky part: these sensations often come out of nowhere with no clear link to food movement or posture. That's your clue. If this type of pain hits suddenly and doesn't feel normal for you, don't brush it off. Neck and jaw. Jaw pain can be an early overlooked sign of a heart attack, especially in women over 60. 4. Unusual fatigue. When exhaustion is more than just getting older. If walking just a few steps leaves you winded or you feel too drained to take a shower, get dressed, or even make breakfast, your heart might be struggling to pump enough blood to the rest of your body. Many people experience this kind of crushing fatigue for days or even weeks before a heart attack hits. But they often blame it on aging, poor sleep, or lack of exercise. The truth. A weakening heart can leave your body in a constant low battery mode no matter how much rest you get. What makes it tricky is that unusual fatigue is one of the most overlooked heart attack symptoms in seniors, especially women. If you're feeling tired for no clear reason and the exhaustion doesn't go away, especially if it comes with shortness of breath, back pain, or a racing heartbeat, don't ignore it. This could be your body's quietest, but most important warning. 5. Fainting or nausea. When your heart fails to fuel the brain. Ever stood up and suddenly felt lightheaded, like the room tilted? Your vision went dark, or you were about to hit the floor. That's not always just low blood pressure. It could be a red flag that your heart isn't pumping enough blood to your brain. When blood flow drops even briefly, the brain gets less oxygen, which can cause dizziness, blurred vision, or even fainting. In older adults, fainting or near-fainting episodes can be a serious early warning sign of a heart attack. But that's not all. Feeling nauseous, losing your appetite, or vomiting when it's not related to food or digestion can also signal trouble with the heart. And here's what's tricky: these non-chest symptoms are much more common in women. So if you felt off balance, had unexplained nausea, or passed out recently, even just once, don't wait it out. Your heart might be trying to tell you something, and it's not a message you want to miss. 6. Cold sweats and shortness of breath. When your heart is quietly struggling. If you're just sitting down, watching TV, reading, or doing absolutely nothing, and suddenly you break out in a cold sweat with your back, forehead, or palms drenched like you just ran a marathon, that's not the weather talking. That's your heart throwing a silent alarm. When your heart doesn't get enough blood, your body kicks into panic mode, trying to cool itself down even though you're not exerting any energy. This often comes hand in hand with shortness of breath, a sense that you can't quite catch your breath, or that lying flat makes you feel smothered. Some people say it feels like they just ran 3 miles even if they only walked to the kitchen or didn't move at all. If you've ever experienced this, especially early in the morning or right after a big meal, don't dismiss it. Cold sweats and difficulty breathing are 2 of the most commonly misunderstood symptoms of a heart attack. 7. Coughing and wheezing. A whisper from the lungs, echoing a tired heart. Have you had a nagging cough, especially at night, even when you're not sick? A dry cough, wheezing, or even coughing up pink frothy mucus might not be a lung issue at all. It could be your heart asking for help. When the heart weakens, blood can back up into the lungs, causing mild fluid buildup, also known as pulmonary congestion. This can lead to shortness of breath, nighttime coughing, and a soft wheeze when you inhale. It's easy to mistake these symptoms for asthma or chronic bronchitis, but the real issue might be much deeper. Your heart is overworked and running out of steam. If you've been coughing persistently, feel tightness in your chest when lying down, or notice unusual breathing sounds, don't wait. Your lungs may be making the noise, but the real problem could be your heart. 8. Swelling. When your ankles and feet reveal what your heart's hiding. Ever noticed your shoes suddenly feel tight by the end of the day? Or your ankles and feet look puffy for no clear reason? It's easy to blame it on salty food or standing too long. But this could be a sign that your heart isn't pumping blood effectively. When the heart weakens, it struggles to circulate blood properly. As a result, fluid can back up in your veins and leak into surrounding tissue, especially in lower areas like your legs, ankles, and feet. This leads to swelling known as edema that may feel soft, and when you press on it, it leaves a dent. But it's not just your legs. Some people also experience bloating or abdominal swelling, which feels like indigestion or fullness. Yet the issue isn't digestive at all. If this swelling sticks around, doesn't get better with rest, and comes with fatigue or shortness of breath, don't brush it off. Your heart might be falling behind, and your body is showing you the signs. 9. Struggling with simple movements. When even a short walk feels like a marathon. Used to walk the dog. Climb stairs or shop for groceries with ease, but now find yourself winded after just a few steps. That's not normal aging. That's your heart waving a red flag. When the heart weakens, it can't pump enough blood and oxygen to fuel your muscles. The body compensates by prioritizing blood flow to vital organs like the brain and heart, leaving your arms and legs starved for energy, making everyday movements feel like a workout. That's why many people with early heart issues feel drained after short walks, need to pause halfway up the stairs, or feel out of breath doing simple things like getting dressed, brushing their hair, or washing their face. If basic tasks that used to be easy now leave you feeling exhausted, don't blame yourself for being out of shape. This isn't laziness, it could be your heart saying, "I can't keep up anymore." 10. Rapid or irregular heartbeat. When your rhythm falls out of step, ever feel your heart suddenly racing, fluttering like a fish in your chest, or skipping a beat only to thump back harder and faster? That's not just a passing moment of nervousness. It could be a sign of a heart rhythm disorder. When your heart isn't getting enough blood or oxygen, it sometimes tries to speed up to compensate, causing your heartbeat to become rapid, erratic, or out of sync. Over time, this can lead to atrial fibrillation. AFib, a serious arrhythmia that increases your risk of blood clots and stroke. If you've ever felt a strange or irregular heartbeat, especially if it's paired with fatigue, dizziness, or shortness of breath, don't shrug it off. An irregular heartbeat could be your body's first warning of something far more serious. 11. Loud snoring and sleep apnea. The silent nighttime danger. Snoring might seem harmless, just part of getting older, but if your snoring is loud, disruptive, or paired with gasping, choking, or sudden awakenings during sleep, it could point to something far more serious as sleep apnea. Sleep apnea causes your breathing to stop and start repeatedly while you sleep, which drops your blood oxygen levels and forces your heart to work overtime, trying to keep up. Over time, this extra strain can lead to high blood pressure, irregular heart rhythms, and a much higher risk of heart attacks and strokes. The scariest part: most people with sleep apnea don't even know they have it, until a partner notices or they end up in the hospital for something seemingly unrelated. If you often wake up tired with a dry throat, headache, racing heartbeat, or feel sleepy during the day, don't ignore it. That loud snore might not just be noise, it could be your heart asking for help. 12. Erectile dysfunction. A warning from your circulatory system. Erectile dysfunction (ED) isn't just a sexual health issue. It can be one of the earliest signs of heart disease, especially in men over 50. An erection requires strong blood flow. If your arteries are narrowed or stiff from plaque buildup, that blood simply can't reach where it needs to go. That means the first red flag of a circulation problem might not show up in your chest but down below. Studies have shown that men with erectile dysfunction are up to twice as likely to suffer a heart attack within 5 years if the underlying cause isn't treated. And yet, too many men ignore the symptom out of embarrassment or assume it's just part of getting older. If ED has become frequent or persistent, don't brush it off. It's not just about masculinity, it could be about survival. 13. Tightness in the throat. When your heart sends a signal through swallowing. Ever feel a sudden tightness in your throat, like something's stuck even though you're not eating, not sick, and there's nothing there? That odd choking or constricted feeling in the throat might not be anxiety. It could be your heart trying to speak up. Not all heart attacks start in the chest. For some people, especially older adults, the first symptom is a strange pressure or squeezing sensation in the throat or neck. Some describe it as if someone is gently strangling them from the inside without a cough, cold, or sore throat in sight. This symptom is often mistaken for acid reflux, chronic throat irritation, or even stress. But if that tightness comes out of nowhere, especially while you're resting, and is paired with fatigue, shortness of breath, or a racing heart, don't ignore it. Your heart may be sending a desperate message through your throat. 14. Extreme anxiety or a sudden sense of doom. When your gut instinct isn't wrong, you're fine one moment, then out of nowhere, a wave of unease hits. Your heart starts pounding. Your hands turn cold. Your whole body feels on edge, like something terrible is about to happen. Sound familiar? Many heart attack survivors describe this exact feeling in the moments before their attack. It's known as a sense of impending doom, and it doesn't come from nowhere. When your heart is in distress, blood flow is low. Your heartbeat becomes erratic, and your blood pressure swings. Your brain reacts with full-blown panic. Here's the danger. This sensation is often mistaken for a panic attack. People try to rest or take anti-anxiety meds assuming it'll pass. But if you've never dealt with chronic anxiety and suddenly feel overwhelmed paired with chest discomfort, shortness of breath, or dizziness, call for help immediately. That gut feeling could be your heart's last-ditch effort to save your life. 15. Stomach pain, bloating, or indigestion. The most misleading heart warning. Many people walk into the ER complaining of upper belly pain, bloating, nausea, or heartburn, convinced they have a digestive issue. But when the GI tests come back normal, the real culprit surprises everyone. It was a heart attack all along. In women and older adults, heart attacks don't always start in the chest. Sometimes the first sign is discomfort in the upper abdomen, right where the heart sits just above the diaphragm. It might feel like gas fullness, queasiness, or a sudden loss of appetite. That's why so many brush it off, pop an antacid, and wait it out, wasting precious time. But if these digestive-like symptoms come on suddenly, last longer than usual, and have no obvious cause, especially if they're paired with fatigue, cold sweats, or mild pressure in your chest or neck, don't assume it's just your stomach. Your heart may be trying to warn you in the most unexpected way. The heart is the only organ in your body that never takes a break from the moment you're born until your very last breath. And before it breaks down, it always speaks up. But it doesn't scream, it whispers. Subtle signs like unusual fatigue, a dull ache in your back or neck, lightheadedness, nighttime coughing, or even just the feeling that something isn't right can all be early warning signs of a heart attack. The problem: most of us dismiss them as part of getting older. Don't wait for crushing chest pain to take action. Don't tell yourself it'll feel better after some rest. For anyone over 60, recognizing these quiet red flags early on could mean the difference between decades of healthy life and a life cut short. If you're someone you love has experienced 2 or more of these symptoms, get your heart checked. Now, because with heart attacks, sometimes even a 1-minute delay can last forever.